Thank you all for being here today for our With You at Annie Penn Hospital. I'm Jessie Metter, the Assistant Director of Marketing and Community Outreach at Annie Penn, and today I'm happy to introduce Angie Orth, our new interim president. Thanks for being here with us today, Angie.
Hi, good morning, Jessie. It's really great to be here. It's really nice also to be here in Rockingham County.
We really appreciate that. And, we are all sad to see Cindy leave, and we really appreciate what she did here. And we hope that she's off enjoying her retirement life. And we feel like we're really lucky to have Angie here with us at Annie Penn Hospital. So we're going to get to know her a little bit today and what her plans are for Annie Penn Hospital. So first, can you tell us a little bit about yourself? Your degrees, credentials, that sort of thing. Who are you?
Yeah, thanks, Jessie. And I really appreciate the opportunity to talk with you today and to share a little bit about myself. So I'm Angie Orth. My formal name is Angela, but I go by Angie, which is my nickname. I'm a native of North Carolina. I've been here my whole life. I raised my family here. I've predominantly spent my entire career in the Triad region. So in Guilford County, Randolph County, and now in Rockingham County, serving the industry for about 37 years. I was fortunate enough to have started in the healthcare industry at a very young age. While I was in high school, I actually served as a cashier at Moses Cone Hospital, and that was my introduction into the healthcare industry. And over a very, very long career, I have been privileged to be able to serve the communities of these three counties in all kinds of various capacities. Most recently, I served as the CEO of Randolph Health, a rural community health system in Randolph County. That organization recently sold to American Healthcare Systems, and I had the opportunity to come here. Prior to that, I spent the majority of my career at Cone Health in a variety of capacities, including the serving as the president of Wesley Long Community Hospital. I grew up in Greensboro, went to Page High School, graduated from there, and I also went to Weaver Academy and took classes at Weaver Academy in downtown Greensboro. I received my undergraduate degree from the University of North Carolina at Greensboro. I wanted to be a clinical psychologist, decided to stay in business on the healthcare business side of things. And so I went and received an MBA from Wake Forest University. I also am I'm a fellow in the American College of Healthcare Executives and like to participate in various things in the industry to keep myself relevant and up to date. In terms of volunteer work, I've spent a lot of time in the communities. Currently, I'm serving as the chair of the United Way in Randolph County, the board of the United Way of Randolph County. I've previously been involved in the Boys and Girls Club, and I also am pretty active in my church. I have two children, Kaylee and Matt. They're both grown. They both live in Greensboro, and I'm getting ready to be a grandma for the first time. My husband, Keith, is retired. He retired from the United Parcel Service, where he served over 30 years. And we have two dogs, Sadie and Nala.
That's great. Thank you, Angie. So you mentioned a couple of things in there. I just want to ask a couple of questions on. You are a fellow for the American College of Healthcare Executives. Mm-hmm. Can you tell me a little bit about what that means and why that's important to you?
Sure. So the American College of Healthcare Executives is an international organization where healthcare leaders come together and they provide, the college provides continuous education for healthcare executives and leaders in the industry. The importance of that is that the healthcare industry is changing. It's constantly changing. And so this provides an opportunity for me to stay relevant on various healthcare topics. To become a fellow in the American College, each participant that wants to be a fellow must take an exam, a very difficult examination, and you must pass that examination. And so I was able to do that and received the fellowship recognition, and every 3 years I have to re-up that, or and the way that in which you sort of renew your fellowship is that you continue to have education credits or you take the test again.
Awesome. That's a lot of good information. I am aware of the American College of Healthcare Executives, but I don't know what the fellowship is. So thank you for that. So, of course, you successfully led an acquisition after a declared bankruptcy to keep this community resource available in Randolph County. Can you tell me what was the hardest thing about that experience? I mean, obviously, it's something that's near and dear to your heart, and how did you handle that?
Yeah, well, thank you, Jesse. I was really honored to be selected as the CEO of Randolph Health at a point in which the organization was getting ready to go through a pretty significant change. So when I became CEO, we needed to reduce our debt in order to become attractive to identify a buyer. So through a 3-year protracted M&A process and through a bankruptcy, we were able to identify that buyer and sell the organization out of bankruptcy. And the organization actually now is doing fine and is thriving under American Healthcare Systems, LLC. The most difficult thing, I think, in that experience was the length of time that it took. The healthcare industry is really is a changing environment right now. It's difficult to get deals done. And so I was really, thrilled that we were able to find a buyer. Keeping the community informed was very important in that process. Keeping our employees informed. Communication was paramount to maintain trust. And so one of the difficult things about that is just making sure that everyone is on board. And it took a lot of energy and time, necessary time, to keep the community apprised of our activities so that they stayed focused on the goal, which was to sell it.
Great. And at Annie Penn Hospital, of course, we're in a different type of situation. We're very financially stable, and we're a part of Cone Health, which gives us lots of resources and backing. So can you tell us about your ideas of how you'll take that experience of what happened at Randolph and everything that you went through and apply that to your work here at Annie Penn Hospital?
Sure. So I'm really excited about being here. There are many, many positive things about Annie Penn that I look forward to exploring and moving into the future. So one of which is growth. So Annie Penn is really primed for growth. You mentioned that we're financially stable, and that is absolutely correct. Fortunately, Annie Penn is part of Cone Health, which brings a lot of strength to the organization, a lot of resources. And so I really look forward to growing our business, growing the service lines that we offer. So we have recently been able to hire a new orthopedic surgeon, 2 new GI physicians, and we will be able to work with those physicians to really grow the business here. I also look forward to identifying new services that we might can provide here in Rockingham County to strengthen the service lines that we provide our community. I look forward to partnering with the community and identifying what are the things that our community believes that we need to be working on and focusing on, and then taking those to Cone Health so that we can together see if those things are possible.
And that lines up perfectly with our, values of caring for each other and caring for our patients in our community. And, it's one of our strategic priorities to keep care local. Mm-hmm. So, that's a great way to align those things within the Rockingham County community.
Absolutely. And if I could just comment, Jesse, one of the things that I've been so excited to see is the passion of our workforce and our physicians here at Annie Penn. The employees, our staff, our physicians, our providers seem to be very, very interested in keeping patients local. Even through this COVID situation, I've really seen the commitment of all of our providers and staff in making sure that we can do our utmost best to keep patients here and treat them locally.
Absolutely. It's so important. So we're going to switch gears a little bit and talk about some of your more personal background. I understand from our conversations you're an avid runner. Um, Talk to me about how you enjoy that, because I'm not a runner. I can't understand that. And what it means to you,
So I have been a runner, Jesse, for a really long time. I probably should say that I enjoy fitness. I enjoy the outdoors. I enjoy being active. And the reason that I enjoy being active and enjoy fitness and running in particular is because it does a couple things. One is it keeps my body healthy, but it also keeps my mind healthy. Running is a difficult sport. It's a sport that requires a lot of mental tenacity and strength. And so I use it for the purpose of staying fit, but also for the purpose of of challenging myself to do things that I might not think are possible. So it's more of a mental challenge as well as a physical challenge. So you might know that I've run lots of races. I've done lots of 5Ks, lots of 10Ks, lots of half marathons, and I've run 6 marathons, 6 full marathons. And the marathons, what's interesting about those is that it requires a very long-term commitment to a schedule. And the schedule really is taxing emotionally. And so I believe that through that taxing emotionally, that it makes me a stronger person. And I can apply that to other difficult situations that I might be faced that are not fitness related.
I like that. All need a little bit of mental and health stimulation from time to time. Do you have a favorite marathon that you've completed? And maybe one that you hope to complete one day and haven't been able to?
Absolutely, absolutely. So I have the goal of completing the top 5 marathons in the country, in the United States. And those top fives include the New York City Marathon, the Chicago Marathon, and the Marine Corps Marathon. Those 3 I have run. I need to run the Boston Marathon and the Los Angeles Marathon in order to obtain that goal, that lofty goal. It's a very difficult assignment, but one that I'm pursuing. My favorite marathon was actually the Marine Corps Marathon. It is put on by the Marines, the United States Marines, and I found it to be an incredibly uplifting experience. It's a way to honor our military and servicemen and women, and I just found that to be an absolute wonderful experience.
That's great. Maybe we'll get to see you complete some of that while you're here at Annie Penn. That will be awesome to watch. So I also hear that you're a Disney fanatic, and you and your husband travel there quite often. Can you tell us a little bit about why that's so special to y'all and why it's important to you?
Yes, absolutely. So I've enjoyed Disney for a very long time. My first trip to Disney was in 1987, I believe. And I have continually traveled to Disney since that time. My husband and I took our kids often when they were young, and as adults, we continue to go and spend a lot of time there. In fact, about every vacation that we go on is at Disney. I really enjoy Disney for several reasons. One, it is fun. It's a great place to just have a nice time. It's a good family environment to be in. The other thing that I really enjoy is I really enjoy looking at and learning from Disney, from their vision and from the way in which they manage their customers. They have an excellent customer experience. And every time I go to Disney, I bring something back that can apply to the healthcare environment.
Yeah, they have their processes down and they know their customers. It is impressive. That customer experience is really important down there. So we're going to shift back again and talk a little bit more about your leadership style and plans for Annie Penn while you're here. You've talked a couple of times of how you want to be involved in the community, and that I know that you have a servant's heart just from your short time here at Annie Penn. So why is service so important to you, and how do you live that out as the leader of Annie Penn Hospital?
Absolutely. So I really enjoy at a deep level working with people. Working with people to strive towards achieving goals. mutual goals that we have collectively together. So I approach my roles, my jobs, whether that's here or at another organization, from the perspective of we are all teammates, we're all team members aspiring to achieve a goal or to solve a problem or to provide a service. And so that requires that we all identify our strengths and then we focus on those strengths as a team, because each of us brings something different to the table. So from a servant leader perspective, what I try to do is I try to identify where those talents are of the people that I work with and elevate those talents and give them opportunities to work on things or lead projects in a way where they can be the best that they can be. Usually that will result in achieving the organization's goals and objectives as well. Now, why do I think community is important? I think community is important for the same reason, is that it takes an entire village to really serve the people of a county. And so being involved in the community allows me to identify ways where I can use my strengths to help elevate the county's goals and objectives.
And we're really happy that you see it from that, 360-degree view, and appreciate that perspective here. And so you've been at Annie Penn for a little more than a month now, and you're an experienced hospital executive. So you've seen a lot, but is there anything about Annie Penn Hospital in particular that surprised you or that, you were glad to see when you got here?
Yeah, actually, I have been so impressed with the busyness of the campus, the vibrancy of the campus. It's a very vibrant, robust healthcare environment here. It's a nice facility, a nice plant. We've had lots of updates, which is just wonderful to see. The people that are here are very committed to our patients to provide excellent quality, low-cost healthcare, local healthcare. So I'm just thrilled actually to be part of this organization and to help it continue to thrive.
Great. And what makes you get up and come to Annie Penn every day? It sounds like some of those things, but is there anything in particular?
I think it's the collaboration, just the collaborative spirit that I see here, the caring spirit of the group here. I've, over a short period of time, feel like I've gotten to know a lot of the employees and a lot of the leaders and physicians, and I'm inspired by the great work that they're doing every day, and I just want to be part of that.
Awesome. Thank you. And so as a part of that, Annie Penn has been a community staple and has served our county for more than 90 years. So what does success for Annie Penn look like to you as we move into the future?
Yeah, great question. So having experienced in rural healthcare settings, I can say that rural community hospitals and health systems are necessary. They're a necessary part of the fabric of communities in the United States. And as you know, many hospitals across the United States that are in rural communities have closed. Fortunately, Annie Penn is not in that situation. We're in a very solid, we're on solid financial ground. We're part of a great organization. And so for the future, what I believe is that we need to keep providing excellent services to our patients, a great patient experience, remain financially sound, and provide an excellent work environment for our employees. We need to continue to strive to offer new services that are appropriate for a rural community to provide. We need to continue to attract new physicians to our community so that we can keep the care local. Convenience is very important to our patients. Access to care is important to our patients. So those are the things that we as a team should continue to focus on and deliver for our citizens of Rockingham County.
Absolutely. And a part of that you mentioned earlier is the response to the COVID pandemic. So you joined right as we stepped into this next surge. Can you talk to us about what it was like to walk back into a hospital after a short break as this began to pick up?
Yeah, and so I appreciate that question, Jesse. And I had a very interesting experience as it relates to COVID that I would want to provide an answer to and a little bit of more of insight in. So you're right. When I was at Randolph Health, we led that organization through the pandemic and worked with our providers to address the surge that we experienced during the year 2020. Then I stepped away in June of 2021 as the organization was being sold, and I took a little bit of time off. So I was out of the healthcare environment for about 2 months, and then entered back into Cone Health and at Annie Penn at a time when COVID was beginning to surge. And what I would say is that as an individual, what was profound to me was that how, when you're not in the healthcare environment, how it's really difficult to understand just how taxing and how real COVID is. So for the 2 months that I was at home, I was hearing about COVID on TV, but I really didn't have the same experience that I have being in the hospital setting. And what I want to share is that the COVID situation, and particularly this Delta variant, it is real and it is profound, and it's a very dangerous virus. And I believe of all time, that now I completely understand the importance of the vaccination, of getting vaccinated to mitigate the continued spread of this virus, because people are suffering. Our patients that have this are suffering, and so I guess my takeaway from it is listen to what you're hearing the health system say about the Delta variant, and try to take steps to protect yourself as an individual by wearing a mask, getting vaccinated, wash your hands, and staying 6 feet apart.
Absolutely. And we are hearing in a lot of places that the hospitals are stretched, and that's kind of what we were trying to avoid the whole time over 2020. And of course, we had a solid plan when we had the COVID hospital at the old women's hospital. Things have changed a little bit now that that building has been sold. So can you tell us a little bit about what it really means that our hospitals are stretched at this point in time, so people have an understanding?
Yeah, absolutely. And so when Cone originally responded to the original pandemic, so back in 2020, Cone opened up a COVID facility, which was just a wonderful, outstanding thing to do. Unfortunately, that is not possible now. And so patients that are admitted for COVID 19 are being admitted to existing hospitals within the Cone system. And so the taxing that you're hearing about, or the stretched resources that you're hearing about, is because patients that typically would come to the health system for unrelated COVID symptoms are being cared for, in addition to now COVID-19 positive patients. And so the combination of patients that are non-COVID with COVID is really stretching our resources. And the way that is playing out in the healthcare setting today is that on any given day, we have more patients in our emergency department than we normally can manage. Patients that are requiring admission are actually staying in the emergency department for long waits in order to get into a bed on the floors, the nursing units. And it's not a situation that is sustainable for a very long period of time. So all of us need to be active participants in trying to mitigate the spread of this virus so that we can be prepared to treat patients that need the care that they need.
Absolutely. And, the next 3 weeks that we go through are going to be crucial as we see this peak in COVID hospitalizations and COVID cases in our community. So can you quickly tell us how the system and Annie Penn Hospital are working to handle this exponential increase? Because I think you've told us how the public can help us in that, but of course we have a response for that as well.
Absolutely, we sure do. And so we here at Annie Penn are now admitting patients, COVID positive patients, to our hospital. In the original response, when the COVID facility was open at Green Valley, Annie Penn was admitting patients to the COVID facility. However, today we have improved and increased our readiness. And so that readiness has included opening up beds on our nursing unit that are negative pressure rooms. So we have 13 negative pressure rooms available on the Annie Penn campus for patients to be treated in on the inpatient side. We have also increased our readiness around personal protective equipment and training employees to use that PPE in the right way in terms of donning and doffing or taking it on and removing it. We are very up to date on infection prevention procedures to keep and contain the virus and keep it from spreading in our facilities. We also have trained many of our staff to use N95s, masks, okay, that'll protect them and the patients. Our doctors are responding, they're working together. All of our campuses are working collectively to manage patients across the system. So if patients are not able to be cared for at our facility, then arrangements are being made for them to be cared for at another Cone facility. So there's a lot of active work that goes on 7 days a week to ensure that we are keeping our communities and our patients safe.
Great, thank you. And it's great to know that we had that plan and that, you know, regardless of how stretched we are, we're doing everything that we can to take care of our COVID patients and non-COVID patients. So Angie, that's all that we've got for today. I really appreciate you talking with me and I'm glad that we got to introduce you to our community.
Mm-hmm. Thank you so much, Jessie. It's really great to be here.
Thanks. So we appreciate you all being here with us today. Thank you for letting me introduce Angie to you. And let us know if you've got any more questions that you want to hear from Annie Penn on. You can visit our website, www.conehealth.com/Annie Penn Hospital for more information and, of course, for COVID resources as well. So thank you all for being here and letting us show you how Annie Penn Hospital is right here with our community.